Capstone and Five-Year Plan by Heather Lopez, Nursing 4580, Lamar University. My name is Heather Hernandez Lopez. I'm a registered nurse and I received my associate's degree in applied science at Navarro College. I attended Navarro College's School of Nursing and received my associate's degree in nursing in 2015. After graduation, I started working at Parkland Hospital on a med-surg telefloor. I was there for 2 years before moving on to Dallas Presbyterian Hospital. I have been there for the last 2 years. I am a cardiac nurse on a critical care unit. I'm a member of the unit-based council. I'm the floor's EMAR champion. I have participated in the root cause analysis meetings. I achieved my NCAP. I am a CLABSI champion. I am BLS and ACLS certified. I am also med-surg board certified as well as PCCN certified. Objective 1 practices safe and effective holistic patient care to a variety of patients in multiple health settings from a global perspective and by incorporating theories and evidence-based findings. I feel this was accomplished through the Nursing 4316 Comprehensive Holistic Health Assessments online by using Shadow Health. On Shadow Health, we were given patient scenarios and had to assess the patient and come up with a proper care plan to guide their care. We had multiple patients with different ages, ethnicities, genders, diagnoses, past history, past medical history. The goal was met 100%. Objective number 2 and 3 are combined. The first one supports patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Objective 3 evaluates patient-centered care for patients across the lifespan based on common and complex health needs and compromise multiple health states when considering multiple determinants of health. I feel these goals were met through Nursing 4620 Practice Comprehensive Multiple Health States online and Nursing 4321 Nursing Theories and Online Education through our practicum reflections 1 through 4. We picked a book about a person going through a specific disease process. In my case, I picked multiple sclerosis, and somebody to interview with the same health situation. We compared the patient that we interviewed to the patient in our book and their expected outcomes and what they didn't expect to happen, as well as interventions, and evaluated how their process through their multiple health state changed. We examined the nursing care of adults with compromised health states within the framework of the nursing process, including expected and unexpected responses to interventions. These goals were met 100%. Evidence-based practice and clinical reasoning construct synthesizes clinical and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. I thought this goal was met through Nursing 4390, Nursing Inquiry, Evidence-Based Practice, where we describe the importance of evidence-based practice to patient outcomes through our quantitative research article critique. The article I chose to critique was an article that examined the relationship between patients' age, Braden scale scores, and their pressure injuries, if they had any. This goal was met 100%. Patient or client-centered care. Objective 5 employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interprofessional and intraprofessional healthcare team. I feel like this outcome was accomplished in Nursing 4540, Practice Care of Communities Online, through the community project planning using a windshield survey and the disaster preparedness CBSL. It was for the disaster preparedness, so we had to make sure that our clients were prepared for the disaster that they had their medications and they knew where their medications were going to be stored if they didn't have any refrigerator. They needed to make sure they had access to water. Did they know where the shelters were? Did they know the numbers of their pharmacy or any emergency evacuation routes? Did they know the numbers for the emergency town hotline? If they needed family members, could they get in contact with them? Did they have power? Everything that they needed, just in case a disaster struck. Using a windshield survey, I did a community assessment in a neighborhood close to my home. I then wrote a paper planning implementation and evaluation of programs to improve health of a population. I felt that this goal was met 100%. Professional roles construct differentiates multiple role dimensions and practices with ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intra-professional healthcare team. I felt this goal was accomplished with Nursing 4580, Synthesis of Professional Nursing. It was accomplished through discussion board number 1 with Baby William. Baby William's situation had many healthcare providers involved in this baby's care, and they failed to be prudent and competent members of the healthcare team by not using references to check the potassium dosage, which caused the patient to develop hyperkalemia. This goal was met 100%. Professional roles construct demonstrates professional integrity, effective communication, active inquiry, and service to the community. I feel like this was accomplished through Nursing 4550, Practice, Leadership, and Management in the Healthcare System. Discussion Board 1, Nursing and Healthcare Environment. Discuss health risks in our communities. We were to go around our own communities and observe our population, their age, and what type of health hazards were presented in the community. I felt that this goal was met 100%. My 5-year plan. I will graduate with my BSN this year, and in 2020, I will obtain 1 more year of work experience on my floor. During this year, I will take on the role as a charge nurse. In 2021, I will begin a career in a medical or surgical ICU and enroll in a master's degree program. In 2022, I plan to become an ACLS instructor and take on a charge nurse role in the ICU. I plan to become a member of the rapid assessment team during this time. In 2023, I plan to finish my master's degree. Thank you very much.